we're going to go ahead and continue with the assessment of the neck. Now, when we inspect the neck, we'd want to inspect it in its usual position, which is slightly hyperextended, and watch when the patient swallows. So we want to take a look laterally sometimes, and we can take a better look at the thyroid muscle and better see it when he swallows. So first of all, we want to see that we have a bilateral symmetry of the sternocleidomastoid muscle, which is here. The sternocleidomastoid muscle comes up forward from the back of the ear forward on both sides, as where the trapezius muscle comes down behind the sternocleidomastoid muscle down towards the sides, creating two triangular areas, an anterior and a posterior. So we want to make sure that this is bilaterally symmetrical, which it is in this patient. Also, we want to check the alignment of the trachea. We want to make sure it's right midline, which it is. Also checking for any landmarks of anterior and posterior triangles, like I just stated. We want to check that there is no fullness at the base of the neck that may be caused by hyperthyroidism. We're also checking for any abnormalities, any masses that are prominent that can be seen with the naked eye, webbing of the sides of the cervical neck, any excess skin folds, unusual shortness of the neck, or asymmetry. All of these things could be indicative of some chromosomal anomaly. Now, if we have marked edema in the neck area, this could possibly be associated with a cervical infection, such as something called cervical lymphadenitis. So these are things that we need to look out for and note to further assess where it is warranted. Now, other things that we need to look out for that are abnormal and that need to be also further assessed are the presence of jugular vein distension. Now, the jugular vein could very easily be seen in the posterior triangle, right in this area about, and when it is distended, you will definitely be able to see it, and you can even see it pulsate. Same thing goes for the carotid artery prominence. So these are things that we need to look out for whenever we are assessing the patient. And let me go back and state, because I did make an error. The jugular vein distension, you will not see it pulsate. The carotid artery prominence will be able to be pulsated. The jugular vein will only be distended. Moving forward to the palpation of the neck. Now, this is where we can get hands-on with this. Now, you need to check the trachea by placing a thumb on each side of it, and by comparing, and I think it's easier for him to be facing me. Go ahead and face me. Now, when we do this, we're going to go ahead and place our thumb on either side of the trachea and just compare the space between it and the sternocleidomastoid muscles. And you can easily feel the sternocleidomastoid muscles beside the trachea. And this should all be midline, okay, all the way down. Now, the hyoid bone sits right below the mandible, and it can very easily be felt, and below that is the thyroid cartilage, and below that is the crocoid. So we're going to ask him to swallow, and we can feel that all of these structures do move when he swallows. Go ahead and swallow again. They should be smooth. They should not be tender. So in this case, that is what we find. Now, there is something called a tracheal tug. Now, when we extend the neck, the index finger and the thumb on each of the trachea, we need to place our index finger and our thumb on each side of the trachea below the thyroid isthmus, which we can feel when he swallows. Go ahead and swallow. We can feel for the portion where it connects. And then when we get to that point, we want to feel if there is a pulse at the bottom of this area here. If there is, then we can say that there's a high possibility that this patient may have an aortic aneurysm. So this is also very important to note. Now, as far as checking the lymph nodes of the head and neck, now there are various lymph nodes that are needed to be checked. I won't go through all of them, but it is important to note that they come down all through the neck here and out through the back and down through the sides. So we need to make sure that when we palpate up and down the neck, towards the back and on the sides here of the back of his backside here, for any edema, any masses, or any nodules, any abnormalities there. Furthermore, we need to check the range of motion of the head as well. We're going to go ahead and ask him to flex his head forward, and then go ahead and extend it back, and then we're going to rotate it all the way around, and then side to side laterally, like this, laterally. And it should be smooth and painless when he does that. If we feel that he has nuchal rigidity and he is not able to flex it, this may be due to a meningeal irritation. So it's very important that we get the correct physicians to deal with that sort of problem. As far as muscle strength, the way we test